I appreciate you inviting me. I think any chance that the county has to address such an important group of stakeholders in Orange County about this incredible crisis that we find ourselves in, it's time well spent. So I appreciate the invitation. I think I want to get to topics that I think most of you have questions or interested in. I know the general concept of coronavirus. I mean, we all watch the news every day, so certainly you know as much about that as I do. But some things that you may not be aware of that I think are incredibly important to how well our county will respond to this crisis. One is the concept of regional planning, and that really is the county's role. The county's role in a crisis like this is really to coordinate with the state, coordinate with FEMA, and coordinate within the hospitals within the boundaries and jurisdiction of Orange County. But in doing that, it is very complicated because of the structure of the way that things break out. It's complicated by the structure in which the state manages regional planning, which it's not a criticism, it's just a factor of the structure. So the state of California is broken up into different regions. So Orange County is in what the State Office of Emergency Services identifies as Region 1. And essentially it's San Luis Obispo down to Orange County. So it includes Los Angeles, Ventura, other large counties, and we share resources within the region. So when you hear of things like the USS Mercy that has 1,000 beds roll into Los Angeles Harbor, understand that that resource is available to Orange County residents as well. So those are resources for the entire region. So we have regional resources, and then we have Orange County resources, where we look at the hospital bed capacity of the hospitals that serve within the county borders. And we have over 5,000 current available hospital bed capacity, because most hospitals, in coordination with the county, and obviously they're doing it on their own because they know how to run their business, we're all preparing for what the state and federal government anticipates is a surge of hospitalizations that could occur toward the middle to end of April. That's kind of the timeline that we've all been told to start planning for. So hospitals began reducing elective surgeries and essentially reducing the less critical type of programs and services that are done within the hospital site. So they've created this 5,000 or so bed capacity. We worked with FEMA and with the state of California, and we identified the Fairview Developmental Center, which I know in the past has been, I would say, challenging within the community to use that as a COVID site. So incredible appreciation for that city, that times are different today than they were even 2 months ago. And this concept of not in my backyard is very difficult belief to hold on to when we as a community must all rise together and shoulder a portion of the weight, because it's an incredible burden to bear. But the city has opened up Fairview. We did a press conference with them earlier this week, and that provides 1,100 surge bed capacity. So this is kind of the hospital bed capacity that you see within Orange County. Is it enough? We're not sure, but understand that our bed capacity is available to our region. And so if LA surges first, they may use some of our capacity. Or if we surge first, we may use some of LA's capacity. It is all shared within this broader region. And that is the concept of mutual aid that you see and you hear about quite often when you hear about forest fires and other things. So please understand that we do similar type of planning for these kinds of pandemics, and it's guided by the State Office of Emergency Services, and we've been working quite well with them. In terms of other capacity, I'm certain that you've heard about some of the challenges that we're having with the homeless population. And this is a very difficult challenge for us because it hasn't hit, the COVID virus hasn't hit the population hard yet, but it very well could. And if we don't identify those that are at highest risk and put them into quarantine or stay at home type of options, because we all have homes. So when we're not doing our critical essential work, we're staying in place because it's safer to be at home. What do you do when you're homeless? These individuals are either in very high density living in our shelters, or they're out on your streets. So we believe that for a temporary period of time, moving these individuals indoors into a quarantine situation where they can also essentially self distance and manage in a safer way so as not to spread the viral infections that could exist in this community. We think that that's better for our community. But in doing so, I don't need to tell you, identifying hotels that want to work with us for potentially COVID positive population is very difficult. And the host cities are not as receptive as we could hope. But we understand that. We're not unhappy about it. We're doing the best that we can. But just know that it is an imperfect science, and we know that it's better overall for our community. But for individual cities, it is challenging. We recognize that. I want to share with you a couple of resource guides. Orange County also has a responsibility to provide good, transparent information in terms of what is happening with the COVID positive patients. Where do they reside? How many are hospitalized? So on our website, which is OCHealthInfo.com, OCHealthInfo.com, we update that website every day at 2 o'clock. It provides the number of positive COVID individuals within the county border, the number that have passed away, the number of hospitalizations, the number of ICU beds that are used, and a whole host of other kind of demographic data related to the positives. We think that's very good information. It's updated daily, and generally it's been well received. We have put in there more detail over the last week and identified the city of residence for these individuals. We know that we're waiting on this $2.2 trillion that was part of the stimulus package passed by the federal government. And our region is to receive something in the magnitude of $500 million. But so far, Lucy, I don't have clarity in terms of what I can use that money on and for what period of time. So if we do get that magnitude of resource, I don't know that the actual direct cost of our response will rise to that level. I think it'll be something less than that. So we may have opportunities to leverage some of those stimulus monies and turn them into opportunities to help our businesses. So I'm certainly open to the discussion. I think within the next 2 weeks or so, we'll get more clarity in terms of when that money will land. It was supposed to be here 2 weeks from now, but I know how slow government money can be sometimes. And the administration has not written any guidance on how we can utilize it. So there's still questions. But we'll look at that because I think it's important.
Might be good if we also strategize on how to develop some kind of a portal for jobs that are open in Orange County that people can apply for in this tough time. We know grocery workers are needed, deliveries, logistics. There are some openings, but to find where they might be in one convenient place.
It might be also that we highlight the local businesses that have opportunities. I'll share with you just yesterday, we all know that the state issued revised health orders in terms of facial coverings, right? Where they're no longer taking the position that it's not a benefit. They're saying it could be a benefit, and they're encouraging it. So yesterday we were in contact with a local business here in Orange County that generally made their primary business was manufacturing and producing clothing for the restaurant industry, chef hats, chef uniforms, jackets, pants, etc. And we ordered 100,000 cloth face coverings from them yesterday. And they're going to deliver the first 20,000 within the next week. So we know that businesses are nimble and they're retooling to meet a need that they might be able to pivot and focus on. So I wonder if there's also an opportunity to highlight those kinds of businesses so that they can be more prominent, because we know that in this environment they may not have the capital to do the kind of advertising, but they're providing a really important function during this crisis.
That's really a great point. We know Abbott is a leader in a very quick turnaround, a test that is getting a lot of national attention. Right here, based in Orange County, they're able to produce a test with results in hours. We also know that there's a couple of manufacturers that have retooled their spirits into developing instead hand sanitizers, and are getting barrels of that out to folks. So yes, that's a great idea. One thing that just wanted to give you a notice of, I'm sure you know, business is really asking the governor to defer property taxes to align with the extension for income taxes. And I know the governor is looking hard at that. It's a very tough decision. Local governments have said, please don't do that. We need this money. But the reality is they might not be getting that money anyway. Could you share the impact of that on the county and for business? Certainly Sherry Friedenrich has been a leader in deferring penalties.
Sure.
So talk a little bit about there's
Sure.
a bit of tension between government and business right
There
now
is.
on property tax. Yeah.
No, it's a huge issue. But what I'll share with you is this. As of April 1, there was about $1.8 billion of property taxes outstanding. So 62% of that is for our local schools. And we collect that and distribute to our local schools. 13% of that goes to our local cities. 11% goes to the various special districts, water district, sanitation district, et cetera. And then at the bottom of that is about 5% of that comes to the county of Orange. So within that tranche, I believe that if the governor does an extension and he pushes it out into July, which is the discussions that we've heard, then the county has a program that we are required to run at least through this fiscal year. It's called the Teeter program, and this is where I get a little bit into the weeds. But basically, what the county does is, if there are delinquent property taxes on July 1, the county has to sell debt, and then we push out and make all other tax-receiving entities whole. Schools, cities, special districts, various school bonds, etc. So we have to make that whole. Generally, Lucy, we're issuing, we have a line of credit, and we usually spend about $65 million a year on delinquent property taxes. Lucy, I don't know that I can sell $1.8 billion in short-term debt. And if we waive interest and penalties on it, I don't know mechanically how I would cover the interest and penalties on $1.8 billion when, my receipt out of that is about 5% of it. So, I have no issues with the extension of the tax deadline. The only thing I would ask of the governor is that relieve the burden on the county to issue what could be $2 billion in debt that I don't know that I have the capacity to do. We haven't issued $2 billion in debt since the bankruptcy, Lucy.
I got it. Yeah.
Rachel has received an email question. She will read that.
Yes, thanks, Justin. So this question comes from Chris Leo from UCI Health. Chris asks, is the county currently planning on doing any modeling? We understand that the county has not been doing modeling of projections here for Orange County.
We are working with UCI, and my understanding from my staff is that we are doing some modeling, and the state did last week release the basis of their modeling. So we're looking at that and trying to compare that to Orange County. So there is work that is happening.
Thank you so much, Frank. Again, I know I speak for everyone here, for Lucy, for Rachel, and for all those beeps showing people on the line. We're lucky to have your experience and your leadership on this, and we've watched you really take control. And so we thank you so much for making the time today. And I know you got a long day ahead of you. So from everyone here, thank you, Frank, for your service and your commitment to all of us.
I appreciate the invitation. Thank you so much.